everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about the medical asepsis, in this session we are going to discuss about the surgical asepsis. This surgical asepsis is a more complex process than its counterparts. Here, for performing the surgical asepsis, we need to make sure that we properly maintain as well as prepare the environment, the surgical equipments, the personnel which will be involved in performing the surgical procedures, as well as the proper cleaning of the surgical site. So here, before performing any surgical procedures, before performing any invasive procedures, we should make sure that we follow this surgical asepsis. So here in surgical asepsis, we not only prepare ourselves, but we also prepare the environment in which the client will be in, the equipments which we will be using, as well as we will be properly cleaning the site in which this operation will be going on. During this procedure, all the participants are required to follow a set of precautionary steps that is required in order to prevent the contamination of the sterile environment. One of the easiest and probably the most important step is to make sure that the personnel, whoever is involved in this procedure, must be less in number. One of the easiest and probably the most important step is to minimize the personnel who will be involved in doing this procedure, as well as keeping the conversation at minimum whenever a procedure is being performed for the patient, and keeping conversations at the minimum as possible whenever any procedure is being performed for the patient. Here, not only this, but at the same time, the movement which will be going on in the operation theater must also be reduced. Use of non-perforating devices are also encouraged, and also here, whenever any procedure is being performed, since both the scrub and the non-scrub nurses will be attending the procedure, here the non-scrub nurses must make sure that they should maintain a fair distance from the scrub nurse. So this is just a brief idea of surgical asepsis. Now let's move on to the definition. So this surgical asepsis is defined as the complete elimination of the disease-causing microorganisms or the agents, as well as their spores, from any surface of the object. The complete elimination of the disease-causing agent and their spores from the surface of an object. This is a sterile technique which is used to prevent the introduction or the spread of the microorganism from the environment to the patient. This sterile asepsis is a technique which can be practiced by the nurse in the operation theater whenever any surgical procedure is being performed, or even at the bedside, for example. So this surgical asepsis is a technique which is mainly used in the operation theater where any surgical procedure will be performed, or also at the bedside when procedures such as inserting of the IV or urinary catheter, or even changing of dressing is being performed, and even where sterile equipments and instruments are being used. In surgical asepsis, any instrument or any object is considered contaminated when these objects comes in contact with the unsterile object. So here we must make sure that all these sterile objects must be placed in the correct place, and they must not come in contact with the unsterile or decontaminated objects. So this is what surgical asepsis is. Now moving on to the next, which is the cornerstone of surgical asepsis. So here, for you to be able to perform this technique properly, you need to know what is sterile, what is not sterile, what is the importance of keeping the sterile and the non-sterile objects separately, as well as what are the various techniques that you can use in order to clean the contaminated objects. So what are the various procedures which is included in the surgical asepsis? Here it involves the four procedures. The first one is the surgical hand washing. So as we have discussed in detail about the hand washing in our previous session, I hope by now you have got a clear idea of why hand washing is important, and also I hope that you have got a clear idea of all the steps you need to perform when you are doing the surgical hand washing. This surgical hand washing helps to eliminate as well as to prevent the spread of microorganisms. That is why it is very important for you to perform the surgical hand washing. The next is donning of gown. Here, whenever you are going to perform any surgical procedure for the patient, you need to make sure that you wear a gown in order to prevent the transmission of microorganism, as well as in order for you to protect yourself from being contaminated with the body fluids or with the blood of the patient. The next is applying and removing sterile gloves. So here it is very important that before you perform any surgical procedure to the client, or before you perform any invasive procedure to them, you need to make sure that you wear your gloves. In this manner, this serves as a protection from all the body fluids, the secretions of the patient, because from here there are many diseases that can be spread, because here you will be in direct contact with these microorganisms, right? So you should make sure that whenever you provide this kind of care to the patient, you should always wear your gloves, and you should always wash your hands before and after you have removed your gloves. And the last one is sterilization of equipments. So here, any equipments which can be reused, you must make sure that you must properly sterile it with the various technique in order to make it free from the microorganism before they are again being used for any other patient. So why is this sterilization important? Here, by the use of this sterilization, many microorganisms such as the bacteria, the parasites, or the spores can easily be destroyed. So here, if there are any equipments which can be reused, we must make sure that we properly sterile it in order to destroy all these microorganisms which are present in it before we use it for the other patient. Sterilization is normally accompanied by the use of heat, and preferably the moist heat which will be under pressure, for example autoclaving. So here, whenever we sterilize any object or instrument, it is normally accomplished by the use of heat, preferably the moist heat which will be under high pressure, because in this manner all the microorganisms will be destroyed. So under sterilization, there are various techniques that we can use. The first one is the disinfections. So here, disinfectants are the ones which we can use in order to destroy any harmful organisms, with the exception of the spore forms of bacteria. So here, this disinfectants is mainly used in the medical emergency treatment situation, where the spore forming of importance are those that cause tetanus and gas gangrene. So this tetanus is usually caused because of the absence of the anti-tetanus inoculation, whereas the gas gangrene is a serious condition that usually threaten the wounded patient, especially to those whose wounds are deep and dirty and in which the oxygen supply is limited. So with the use of this disinfectants, we can clean it, and this will destroy the further growing or spreading of these harmful microorganisms. And the next one is boiling. So here, boiling is only considered when the saturated steam with high pressure is not possible. However, we must make sure that before we boil the articles, we must clean it properly, and then we must immerse it in the solution with the surfaces open, and then we can start boiling it for 30 minutes. So here, the needle, metal cannulas, the glassware, and the surgical equipment and instruments, as well as some of the rubber goods, can be boiled in order to destroy the microorganisms which are present in it. And the next one is the chemical disinfectants. So here, many chemical precautions are effective as disinfectants. The chemical disinfectant which is commonly in use today includes Cydex, Vescodine, isopropyl alcohol of 70%, and certain phenol preparation that is specially designed as a disinfecting solution for the inanimate objects. However, any materials here which are not harmed by water will definitely not be harmed by the disinfecting solution of these chemicals as well. That is why the use of the liquid chemical disinfectant must be severely limited to those occasions when the saturated steam under pressure such as autoclaving is not available, or when the steam sterilization can damage the articles. So here we can also clean various articles by the use of these chemical disinfectants, but we must make sure which articles can be cleaned, because sometimes by the use of these disinfectants it can also damage it, and also there are some instruments, there are some objects which cannot be cleaned or which cannot be disinfected by the use of these chemicals. However, if the instruments and the supplies are not adversely affected by the chemicals, then they may be immersed in the solution of the chemical disinfectant for a specified time by the label of the container, by establishing a procedure such as that of a hospital or the aid station, or by a person who has the knowledge of the disinfecting properties or of the various chemical solution. And once these articles has been disinfected, then you must make sure that they must be flushed well under the normal saline, and they must be dried before they are being reused for another patient. So this is about the chemical disinfection. Now moving on to the next is by the use of antiseptics. So here when we use the antiseptics, it helps to destroy the growth and the development of the pathogens without necessarily destroying the agents. However, these antiseptics are milder than the chemical disinfectants by the nature or by the strength. That is why this can be directly applied to the skin of the patient as well. So here in the aid kit, you will find that there are various antiseptic solution which will be included. For example, the povidone iodine solution, or even the ointment, the surgical detergent which consists of 0.5% of the povidone, and also the 70% of the isopropyl alcohol. So if these are readily available, then they can be applied around the superficial wound when the hemorrhage is not severe, or even in the surgeries whenever it is indicated or is expected to be delayed longer than 6 hours after wounding. So by the use of this antiseptic solution, you can also kill the microorganisms. However, these are milder than the chemical disinfectants. That is why it can directly be used on the skin of the patient as well. And the next one is the cleansing agent. So here, by the use of soap, water, as well as surgical detergent preparation and water, we can also kill the microorganisms. So here, the mixture of water with surgical detergents, with or even without the antiseptic solution, mechanically bind dirt and grime them, and with the use of the water, these microorganisms will be washed away. So these are the various techniques of sterilization that you can use depending on which equipment or on which instrument needs to be sterilized. So what are the roles of a nurse in this surgical asepsis? The first one is the isolation technique. So here, as a nurse, you must make sure that you isolate those clients who are suffering from any infectious diseases, because this can easily spread, this can easily transmit the microorganism from one person to the other, or even from the person to the environment in which he lives in. The second one is by wearing the protective clothing, which is by wearing the mask, the gloves, the gown, because in this manner you will be protecting yourself from the body secretions, from the body fluid, as well as from the blood of the patient. By keeping a check on the visitors. So here, whenever a patient is admitted with any infectious diseases, we must make sure that we limit the number of visitors, because here, when a person is suffering from any infectious diseases, this can easily transmit the microorganism. So we must limit the number of visitors, as well as we must educate the visitors on the various hand washing techniques, as well as the various techniques which they can adopt to in order to prevent themselves from getting these infections. The next one is hand washing. So here, as I've been repeatedly saying, that this is the most effective method in order to wash away or to kill the microorganisms which may be present in our hands. So here we must make sure that we educate the patient, the family members, as well as the visitors on how to perform the hand washing, as well as what are the various benefits that one may get by performing this procedure. The third one is training and administrative control. So here you should also educate your healthcare workers, as well as you should train them on how to protect themselves from any infectious diseases, as well as on what are the various methods, what are the various steps they need to do before they perform any surgical procedure for the patient, such as preparation of the unit, cleaning, disinfecting, and all of the other procedures they need to do in order to keep the environment sterile before any surgical procedure or before any invasive procedure is being performed for the patient. The next is sterilization and disinfection. So as we have discussed, that sterilization and disinfectants is very important because this will help to destroy the microorganisms which is present in any instrument or which is present in any objects before they are again being reused for another patient. And the last one is fumigation. So here, whenever a client who is suffering from any infectious diseases is being transferred or is being discharged, we need to make sure that we properly fumigate the unit which he was staying in before we assign that particular unit to another patient. So as a nurse, these are the various roles that you must perform in order to prevent the spread of microorganisms. So now here we have come to the end of this topic, whereby in today's session we have discussed about the surgical asepsis. We've come to know what surgical asepsis is, what are the cornerstone of surgical asepsis, as well as what are the various procedures of surgical asepsis. So whenever you are in the hospital and whenever any surgical procedure or invasive procedure is going to be performed for the patient, you need to make sure that you perform your proper hand washing. You need to wear your protective clothing such as the gloves, the mask, the aprons, and you also need to make sure that the area in which this procedure will be performed must be sterile. You also need to make sure that you sterilize as well as disinfect all the equipments before it is being used, and you need to make sure that you also fumigate the area which the client was living in before it is being assigned to another patient in order to make it free from any microorganisms. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session. Until then, have a good day. Thank you.